One of my dearest friends, we actually met each other through the Instagram DMs. Okay. She is absolutely amazing. She's absolute goals. I won't dig too much deeper than that, but I want to introduce you all to Inspire Primary Care CEO, Dr. Jade. Dr. Jade really helped me have a different outlook on the healthcare system. Right now, the healthcare system is front page news, as many of you know, about the murder of United Healthcare CEO Brian Thompson and how it's sparked so much public controversy and reaction that some would deem as very shocking, but a lot of people are also not surprised by the comments and the feelings that many Americans feel about the healthcare system. And so we talk about those things. We talk about the difference between primary care and insurance-based care. We also talk about what primary care is and is it affordable for us, right? How can we get in on this, what some would deem luxury care? So we're going to talk a lot about that. We're also going to have a little fun. I had her take my blood pressure, so we'll see what those results are as well. But I first asked her, about her mission to serve her community, and I hope you enjoy the interview. You obviously are doing amazing things in your practice. A Black woman here in Las Vegas, your services and who you are just are needed, period. But I want to have a little bit of fun with you and ask you some questions. So
Okay.
what inspired you, first of all, to become a primary care physician?
Yeah. So I was one of those weird little kids when I was little. People would ask, what do you want to be when you grow up? And I've always said, I want to be a doctor when I grew up or when I grow up. And back then I was a little girl, brown girl in Chicago. I was born in Chicago and nobody in my family was a doctor. So people thought that was like a cute dream. They'd say, oh, that's nice, But God just kept showing me this vision of me in a white coat, me taking care of people. I had a pediatrician at the time who owned a private practice, and he was so great. And I would ask him all these questions. I'd love to go to his office. And I started saying, I'm going to have a practice like his. I'm going to have my own practice when I'm a doctor. So people were like, oh, that sounds nice too, not really thinking anything of it. But that dream just never went away. So through college and undergrad, that was still my dream. And I started shadowing different physicians. We moved to Vegas when I was 8. So this is home for me, Vegas. And I started seeing how poor the healthcare system was here. And I said, man, I'm going to come back and serve my hometown. Back then, we didn't have a med school here in Vegas. So I said, I'm going to go get my training and I'm going to come back to my hometown and provide quality care to my hometown. So the dream just never changed. I didn't know I wanted to be a primary care doctor, though. I was a kid who went through all different types of doctor. One day I wanted to be a foot doctor. One day I wanted to be the things you say as a child. I want to be a kid doctor. Of course, now I know that's a podiatrist or a pediatrician, but I went through all the different types, but once I was in med school, I thought I wanted to be an OBGYN. And I was like, I love women, I love babies. I delivered 30 babies in med school and residency, and I thought that's what I wanted to do, but I didn't realize that they're mostly surgeons, and I don't like surgery. And so now I learned about primary care in medical school, and family medicine in particular. And I was like, oh, this is what I love to do. It's in the clinic, which I love. I get to take care of the whole family at all ages and stages of life. I get to help with prevention and lifestyle and get to know them over the years and have a relationship. So I fell in love with family medicine.
What's the most common misconception people have about primary care?
Yeah, there are a lot. A lot of people have no idea what primary care is. They will think that a lot of people don't know all that primary care doctors can do. And that is because in insurance-based practices, a lot of people don't know that those doctors are fired if they spend more than 5 to 8 minutes in the room with patients, because insurance companies make money based on volume. So they need doctors in and out the room as fast as possible.
Really?
To collect as many copays as possible. Yeah, that is the business structure of the insurance-based practice. And so because of that, insurance-based doctors only have enough time to prescribe a pill or give a referral. So a lot of people just assume that primary care is just there to send pills and referrals. But actually, we are trained in so much. We are trained in procedures. We train with all the different specialists. So I train directly with dermatologists, with surgeons, directly with OBGYNs, delivered babies. We get all of that training. And if you're in a practice model where you can practice in the full scope of your training, there's very few scenarios that we actually have to refer out to specialists. So a lot of people don't know that.
And you touch on a very sensitive topic, because right now in the news, there's a lot of discord between what happened with the United Health CEO and how people are feeling overall, it's coming off as very disturbing how people are kind of celebrating. But you just touched on that point as to why either people are not educated or they don't trust the healthcare system. Because like you said, if they're getting fired for spending too much time with a patient, which there should never be a time limit on how you spend on your patient. You care about them. They need the help.
Yes.
But the fact that that is something that happens, it just kind of, I'm not saying you're adding fuel to the fire, but it's just, it's telling us something that we kind of already knew, but you're just affirming.
Yeah, people just don't know why. Like, why is my doctor not spending time with me? Why are they cutting me off or telling me I can only say 1 to 2 things? All of that is because of the business model. You have to follow the money. So it's no secret, but a lot of people don't know that we're on camera, but health insurance prioritizes profit over patient care. And so that is why I left the insurance-based system and did a insurance-free practice model. So then I could shift the focus back to healthcare and spending the time. Insurance companies can't make money from a doctor sitting down, hearing your story for long periods of time. They can only make money by collecting as many copays as possible. So that is why Inspire Primary Care is an insurance-free practice and a membership-style practice for that very reason. Letting people know about concierge-style, direct primary care, membership-style practices, just people being aware that there are other options that don't mean expensive. A lot of people assume that if I'm doing or going to a medical practice that is not insurance-based, oh, that's just for the rich, or that's too expensive. But it doesn't have to be. Employers are now offering this benefit. That's something we do here through Inspire Primary Care is corporate memberships where employees and businesses can offer it as a benefit, or individuals can actually find out that it's actually not that expensive. It's not for the rich. So just knowing that there are alternatives that can increase your quality of care if you're not getting a good experience in the insurance-based office. People just need to know that they need to advocate for themselves and there are better options out there.
Do you mind taking my blood pressure?
Yeah,
okay.
Yeah, we'll take your blood pressure.
Let's see how healthy I am.
All right, let's see. Otherwise, it's not going to be accurate.
About to put my health care.
All right, let's get you. And then I'll have you rest it here because it's most accurate if it's heart level. And then just letting people know what we're looking for. You want to have the feet uncrossed on the floor. You want to try not to talk during it. That can falsely elevate. For those who are watching, if you have one of those wrist cuffs, those are less accurate than an upper arm. So we want it to be an upper arm cuff. When you said, what are some questions? I've never been asked to do a blood pressure on an interview. So this is the first. So I love that. All right. We have a number.
Okay. Doctor, give me the results.
Do you want the results?
Give it to me straight, doc.
So your blood pressure is 136/84.
Okay.
So this goes into something good to know. Again, you need a doctor that will explain these things to you. There are 2 organizations that tell us what a healthy blood pressure are. There's the JNC8. These are the kidney doctors. They look at blood pressure due to hypertension. This is like things that can lead to dialysis. So the kidney doctors say we want the top number, the systolic number, to be less than 140, and they want that diastolic number to be less than 90. So according to the JNC doctors, you have a healthy blood pressure. However, there's another organization, that's the American Heart Association, or the AHA, and they have a bit tighter guidelines because they're dealing with high blood pressure that leads to heart attack and strokes. And they say, well, that top number needs to come down to help prevent the heart attack and strokes. So they want to see that systolic number less than 130. So yours is 136. So they would say yours is elevated compared to their guidelines, and they want the diastolic number less than 90, 80 to 90. So now mildly elevated.
Now, would that be because I'll tell you, I've only had coffee this morning. So does caffeine play a role in what's playing out?
There's a
as
lot of
far as
things
the
that can play a
number?
role. Caffeine can play a role. Hydration status can play a role. Moving around. So something interesting is a lot of people's blood pressure will be more elevated in doctor's offices, just alone. We call it white coat syndrome.
Oh.
But just physiologically, a lot of people just get nervous internally when they're coming to a doctor's office.
We don't like coming here.
We don't want to come here. And so I always have my patients do a home blood pressure log. I'll just say, well, this is our office reading, but let me see what your blood pressures are when you're at home in your environment. And a lot of times they'll send me the home log and it's normal.
Yeah.
So it can be that, and it can be that you've been moving around. So a lot of times when people come to doctor's offices, when they first sit down, the nurses will get the vitals. That's why in our office, we don't do that until the middle of the appointment.
Gotcha.
That way you haven't been rushing in.
Right. What is your favorite health recipe to recommend to patients?
My favorite health recipe is going to be something probably unexpected, but really it's doing what you can stick with and being consistent with. So, people ask me a lot like, should I be vegan? Should I be vegetarian? Should I be pescatarian? And I'm like, well, what's going to help you get to your health goals, and then what can you stick to and be consistent with?
Yes, because being a vegan is not easy to stick to, especially if you haven't done it.
And it doesn't pour into everyone's health goals. If you want to build muscle and, then maybe being a vegan may not be what you want to do. But so it's like, what are your health goals? Like, let's dig into that. What are your health and wellness goals? What are your weight goals? What's going to help you with chronic disease prevention and reversal? Okay, now let's reverse engineer that. What's going to be the best nutrition, exercise, sleep, stress regimen to help promote that?
As a Black woman and knowing the strife that Black people have, whether it's education, healthcare, childcare, what do you want to tell Black people here in Las Vegas that they don't know about you, or that may be seeking some kind of medical care but feel like they're not being heard? Like you said, we are in a desert, essentially, when it comes to healthcare and doctors. It could sometimes take months before we see someone, and then are they even taking us seriously when we do see them? So what kind of PSA or any message that you want to give to Black women, Black men, anyone who feels like they can't find a doctor that looks like them and they consistently feel like they're not being heard?
Yeah. I would tell them that, one, I opened Inspire Primary Care in Las Vegas, in our hometown, to help solve that problem directly. So if that is a pain point, then there is a solution here. And I'd love to care for them. Our team would love to care for them. We're a very diverse team. Obviously, it's a Black-owned, women-owned business, but our team is very diverse. We speak different languages. Team Inspire, I love the diversity that reflects our community's diversity. So that's important to us. And so that is one solution, but it's not the only solution. So it's really about figuring out what you need and then finding that, not just settling for who an insurance company has assigned you to, but actually saying, this is what I need. This is what I need my physician to look like, to feel like, so that it feels like a comfortable, trusting relationship, and then get that. As far as being Black doctors in Vegas, not only are we a desert. We are a medical desert. There's very few primary care physicians compared to the population. And then when you look at Black doctors, then that's very minuscule compared to, there's a few of us, okay? So, if that's important to you, then seek that out. But just don't settle. That's the main thing I would say.
Yeah. Can you share a memorable patient story that taught you something important?
I have so many, but, the big part of what I love about what I do as an obesity medicine specialist is helping patients to prevent and reverse chronic disease and transition to a healthier lifestyle and a healthier weight. So I would say the most memorable stories I have are the big weight and health transformations. What I love is that obesity is tied to almost every chronic disease. This is why I went into primary care with a weight loss focus. And if you get people to maintain and transition to a healthy weight, it can help reverse almost all of the chronic diseases. So some of the patients I'm thinking about are the ones who have lost over 100 pounds in our practice, but it's not the weight that, makes me be excited, although we're excited they're a healthy weight, but their diabetes is reversed, their high blood pressure is reversed, their high cholesterol is reversed, their sleep apnea is reversed, their cancer risk is reversed, and they're able to run around and exercise, they're not in pain anymore, and just seeing like their whole life be transformed literally by having quality health care and transitioning to a healthy weight. Those are like the most rewarding things. I actually had a patient leave our practice today that had all of those things that I just said, and she lost 107 pounds in 20 months of being a part of the practice, and all of those chronic diseases have been reversed. So that
That's
is
dope.
my best, most, it's just, I told her this is why we opened Inspire Primary Care.
Yeah.
Yeah.
And I know it's also important for women, Black women, and women of color to see someone that looks like them helping them through this experience, right?
Yeah.
Because our bodies are different.
Yeah, absolutely. And I tell people like Inspire Primary Care is for all cultures, but it's something special about having someone that looks like you to understand the cultural aspects. People like to think that medicine isn't racist, but it is a lot of racism built into our training. And so just not having someone just assume things about you just by looking at you, and to treat you medically and manage you medically based on assumptions, versus first getting to actually know you and your story. So yeah, I'm so thankful that we're able to provide that aspect for our community too.
Now, with your own private practice, how do you balance work and life? I would assume that this makes it easier, but I mean, that's just an assumption because obviously having your own business requires 24/7 work. So how do you balance?
Yeah, it takes a lot of prayer, a lot of strategy, like schedule blocking. So I have to really give myself structure. So I know which times and days I do certain things. I have times and days where I'm marketing. I have times and days where I'm networking. I have times and days where I am doing clinical time with patients. So everything has a time and a space. And then I have my non-negotiable time. So after hours and weekends are for my family or for myself. From 6 to 7 is my self-care time where I'm doing prayer and Peloton or prayer and fitness. And so, yeah, just having a very structured, I mean, I like structured. So for me, having a structure and non-negotiable and boundaries helps me.
Did y'all hear pray and Peloton? Okay.
Yeah. That's my P&P in the morning. Yeah.
So once again, I really want what you took from this interview to help you understand primary care versus insurance-based care. I also want us to look at this and make sure that we are taking charge of our own health and not relying on the health that is just laid in front of us, right? There are options, and there are people that look like us that can represent us and give us the best care possible. And it really isn't any more expensive than what's coming out of your paycheck. And so when we know what options we have, we can make better, more informed decisions. And I hope that this interview with Dr. Jade helped you understand what that could look like for you and your family. And, all I can say is I'm just blessed to know someone like her. I'm blessed to know and have the resources to be in rooms and spaces with doctors such as herself, because this also helps me as a resident here in Las Vegas. And it's nice to know that in this healthcare desert that we're in, that we have primary care providers like Dr. Jade at our fingertips, and she's here to help us. So if you have any questions, please feel free. You can go down in the comments below. Also, I will leave her Instagram and her website and all the information. So if you want to speak with Dr. Jade, if you have concerns about your own health care, then you can get in touch with her down below in the comments. Until the next episode.